Hi, I'm here with Dr. Amber Borucki, who's the Chief of Anesthesia Pediatric Pain Services here at UCSF. And she's here to talk to us today a little bit about the fellow pain rotation. So thanks for joining us.
Thank you for having me, Dr. Ferschel.
So tell me a little bit about the pain experience for our fellows.
Sure, happy to explain. So the fellows they are able to, or they do take a 4-week course that's on pediatric pain specifically. There are multiple different components of this, and so I'd love to go through those with you. One includes the kind of regional anesthesia component, which would be where the fellow would be able to go place single shot or catheters, blocks that are done in the operating room. The second component would be the actual acute pain service that we call the anesthesia pain service, where then the fellow would be able to then follow and manage and maintain epidural catheters or regional nerve catheters. Um, an additional component would be the chronic pain service. So we actually have a significant number of patients on our chronic pain service where the fellow would then be able to rotate with the chronic pain service and get to see all of these patients in management. And then the last component would be our clinic. So we do have pain clinic that the fellow would be able to attend, where they would get to see patients in the clinic and possibly do procedures. And then embedded in all of that is an ability to attend all the didactic lectures that we have on our pain service, which often we have lectures on Thursdays from 2:30 to 4. And then there's also an additional component where the attendings on service each week would give a lecture as well about pain, about pediatric pain.
Perfect. Tell me a little bit about the makeup of the pain service and the different providers that our fellows get exposed to.
So our pain service is a really wonderful example of a multidisciplinary model. So our pain service, our overall pain service includes physicians that are anesthesiologists or pediatricians. We also have uh, massage therapists, acupuncturists, a pain psychologist. We also have an additional arm of our pain of our overall service, which is a palliative care arm, which does interface with the pain service often. So you may work also with the palliative care physicians. Um, so there is a significant number of different types of not only physicians but also providers that you'll get to work with, and also have the opportunity to shadow them. So there's shadowing opportunities for the acupuncturist or our massage therapist, shadowing opportunities in integrative medicine, and palliative care if you're interested. So definitely a really wide array of providers you'll be working with.
Great. And finally, let's just talk a little bit more about the regional experience. As you mentioned, the regional experience is embedded into the pain rotation. But tell me a little bit about what it's like for the fellows and what types of blocks they get to do.
Wonderful. Great question. So the fellow who's on service for the month, it's kind of known in our through the anesthesia faculty that that fellow would get be first in line if a block were to happen in the operating room. So they would be generally contacted by the attending, and they would be the first in line to do any block that's done in the operating room, any regional anesthesia block that's done in the operating room. And then from there, say a catheter is placed, then the fellow would then manage or maintain that catheter on the floor while the patient has for the duration of the catheter. The fellow would also then uh, be able to, as I said, manage other patients who may have single shot blocks but have acute pain needs. We do have some really interesting programs here that do incorporate regional anesthesia as almost part of an ERAS protocol. So we do have an interesting program where we do total pancreatectomies for patients with pancreatitis, that erector spinae catheters are placed in that protocol, and the fellow would be completely involved with placing that and then managing that patient afterward, which is often difficult pain care. So that's a really interesting program we have. We also have the ability with some of our orthopedic surgeries to place blocks, and also we are using on-cue pumps. So that's another thing that the fellow can also get used to on the service as well.
Great. Well, thanks so much for taking the time to share this information with our applicants, and I'll send them your way if they have further questions about pain or regional.
Thank you so much. Please don't hesitate to reach out with any questions.
Great. Thanks, Amber.